In this lab, we will be looking at the pony specimen, working on the extrinsic muscles of the forelimb. So these are on the proximal forelimb. Before we do that, we'll be doing the skin incisions as directed in your lab guide, and also looking at a few superficial structures of the forelimb. When you start this lab, you'll want to look at your distal forelimb on the inner surface, so the medial side. And so you're looking at this side, looking for the chestnut. So this little thing right here is the chestnut in this pony. Then you would move down distally towards the foot and look for an ergot. So the ergot is going to be in this area. It would be covered in hair called the feather normally when it's in a non-clipped animal, but it's in this area, and sometimes you can actually see a better one. This one does not have a very good ergot, but that would be there. And then down here, the skin to hoof transition is actually called the coronet, and we'll talk about that a little more when we get to the foot. For your incisions on the pony, you'll be starting here, just caudal to the ear, and along the ventral edge of the mane. So here would be the mane if it was still attached. And you're looking at this nuchal fatty crest is what this part is called. And so you're going just ventral to that and making an incision on both sides. So you're going to do this on left and right sides. And then you'll come and make a cranial incision here, just caudal behind the ear, and come down and connect that with the other incision from the other side. So then you will make a ventral midline incision down the neck here. And you'll come down to the forelimb and actually make a circular incision around the forelimb. So coming distal to the elbow, which is right here, come down about 5 to 10 centimeters, make a circular incision around the forelimb so that you create this flap. And you can actually take all the skin down as one piece. So here we continue from just caudal to the mane, down to the mid-thorax or the distal third of the thorax, and make another incision coming down and around and connecting that with the other side. So we'll take that skin down. Like that. So you'll skin out that side, and you'll do that on both left and right sides. And underneath the skin, and possibly coming off with the skin, is this cutaneous muscle. So here, I'll lift it up so you can see it's kind of thin and paper-like, and it sticks to the skin when you take it off. So this is the cutaneous trunci muscle here. And then we also have an omobrachialis portion over the shoulder here. So omobrachialis here over the shoulder, cutaneous trunci extending back along the abdomen. So cutaneous trunci can also be reflected, so you'll take that down as well. And as you do that, you want to note this superficial thoracic vein, also known as the spur vein. So right here is that nice blue vein. Superficial thoracic vein. So that's after you reflect your cutaneous trunci down, you'll see that. So with the omobrachialis portion, you can actually just reflect that all the way off of the shoulder. So reflect it caudally towards the cutaneous trunci and take it all as one piece. That works well. And then we'll move to the brachiocephalicus muscle. So that will be here. Brachiocephalicus is this muscle all the way down here, extending from the forelimb up towards the head. And that in the pony includes the omotransversarius muscle. So in the calf that will be a little bit different, but in the pony it includes omotransversarius, so all of this is brachiocephalicus muscle. Here you can see this flap kind of overlaying the brachiocephalicus slightly. This is the cutaneous colli muscle, and so we'll take a little bit more of a front view of that to look at that and a few other muscles. So this is a more cranial view on the pony, and you'll be looking at the cutaneous colli from this front view, and it makes this V shape right here at the base of the neck. So this is all cutaneous colli, and you can see it kind of goes up and over the side of brachiocephalicus. So it makes it a little difficult to differentiate between those two, but just do your best and come and find this V shape in the middle here. So then you can reflect cutaneous colli. And then you also have this little bit smaller part that's less distinct. It's all called sphincter colli here, and it's kind of attached to your cutaneous colli. It's not very important, and you don't have to keep it, so you can actually take it off and discard it if you wish. But you can reflect cutaneous colli and make sure to keep that attached to your pony. So now we'll move down distally just a little bit, and you can see this vein coming down is the cephalic vein here. So you want to try to avoid cutting that for now so you can at least see it. You also see in this area, there's this fatty filled mass right here, and it's a lymphocenter here in the pony where it has all of these small lymph nodes that occupy that space. So you can try to uncover some of those. So those are superficial cervical lymph nodes, all right there. Then you also want to look at your pectorals. So you have superficial pectorals that have two parts. One part is the descending part. So here you have descending pectoral on either side. And so you want to cut that and reflect it and differentiate that from your transverse superficial pectoral, which is the rest of this. So this is all transverse superficial pectoral versus the descending, which is just this part. So transverse, you also want to cut right along the sternum and reflect that so that you can appreciate the deep pectorals underneath. So here, these may be a little more difficult to see, but you can see there are two muscles here in the pony. You have the subclavius part of the deep pectorals here that comes up and over the shoulder. And then you have the ascending deep pectoral. So this one here going down the belly. So we'll see that one again when we go back to the other side, but here's the differentiation between those two deep pectorals right here. So you want to try to find that in this area. All right, from this lateral view now, we will be looking at some more of the extrinsic muscles of the forelimb. So here we have trapezius, so kind of that triangular shape, similar to the dog. And you have a cervical part here and the thoracic part here. So trapezius, you want to make an arching cut across both of those parts from cranial to caudal, and then reflect trapezius here, and then reflect it dorsally as well, so that you can get to the rhomboideus muscle underneath. So rhomboideus muscle will be here. You can see that it also has two parts. So you have thoracic part here, so that's inserting on thoracic vertebrae, and then you have a cervical part here going up to cervical vertebrae. So rhomboideus muscle underneath trapezius muscle. Here we have latissimus dorsi. So that's another one you want to transect, just caudal to the forelimb here. So make a transection all the way through and reflect it toward the midline of the back. So here's where a lot of people don't reflect far enough. So make sure you take it up far enough that you can see the extent of that rhomboideus muscle underneath. So latissimus dorsi, the aponeurosis, kind of covers this thoracic part of rhomboideus. So uncover that. Make sure you reflect your trapezius and see those two parts of rhomboideus. In this view, you can also see serratus ventralis. So serratus ventralis will be here. So this is the thoracic part of it. You can see the serrated edge here. And then it's also here on the cranial aspect of the scapula. You can see serratus ventralis, the cervical part here, thoracic part here. So then after you transect your trapezius and see your rhomboideus underneath, you also want to transect through both parts of rhomboideus right along the scapula here, so along that cartilage. Cut across both parts and then have a partner help you cross the legs, one leg over the other, and you'll be able to see underneath is this dorsoscapular ligament. I'll put my probe under it, so hopefully it'll help so you can see it. But that's the dorsoscapular ligament, and it's well developed in the pony. So hopefully you can see that as you cross the legs. It will help kind of pop it up. And then after that, we are going to be taking off the left limb. But before we do that, I want to just take a quick look at the right side. So here from the right-sided view, I just want to show some of the same things. You're doing the same dissection on both sides at the same time. So here the skin has been reflected. We have that cutaneous trunci muscle here, the omobrachialis portion over the shoulder. So you're going to reflect that. I recommend keeping it on one side but not the other. So you can actually take off the cutaneous trunci if you want to on one side. I would try to leave it attached on one or the other, whichever is better. And then here you can actually see as you take off that cutaneous trunci, when you get down to the midline of the belly, you can actually see that ascending deep pectoral coming along the belly here. So this is all ascending deep pectoral that we looked at from the front view coming here along the belly. And here's that stump of that superficial thoracic vein. So when you take off the cutaneous trunci, you can feel free to cut through that. All right, on this side, I left the cutaneous colli kind of overlapping the brachiosephalicus muscle, so you could see that it is a little bit difficult to pull that off of there. So cutaneous colli, reflect that. Here's your brachiocephalicus again. On this side, I did a little more of just kind of defining the borders of the muscles and not taking off all of the fascia. So that's more of what you'll be doing rather than making it look like demo. So you'll be taking less fascia off, like here I've left all this on. Basically, you want to be able to see the borders of the muscle and be able to find where to cut. So here we've got latissimus dorsi that's been cut just behind the forelimb. Here we have trapezius, again that arching cut across. So reflect both of those. And then underneath you have the rhomboideus muscle, both parts here, the thoracic and cervical parts. And here you see that serratus ventralis here, and then serratus ventralis here. And actually one other thing I want to point out while we're here, this is the subclavius muscle, the deep pectoral that we looked at from that front view coming up over the shoulder. So it's coming from underneath this brachiocephalicus muscle, coming up over the shoulder. So that's subclavius. And then here if you lift up the brachiocephalicus, you can see again that lymphocenter where those superficial cervical lymph nodes are in that fat. So you'll see a lot of little lymph nodes in there. So make sure and see that. And again, you're cutting through the rhomboideus muscle and then looking at that dorsoscapular ligament deep to the rhomboideus. So now we will be removing the left forelimb. So you want to make sure you've made all those cuts that I talked about making during your dissection, so that you've cut the trapezius, you've cut through rhomboideus, you've cut and reflected your latissimus dorsi, and that all of those are done. The next step will be to cut your brachiocephalicus. So if you kind of set your hand here and make sure you're going at least a hand width cranial, you want to make your cut cranial to your hand so that you have enough to identify later on the limb. So you want to cut basically straight across that and reflect it. However, in the pony, you do want to be careful because underneath that muscle, you'll have another muscle, and it's called the omohyoideus muscle. And so this is in the pony specifically, and you'll want to see that and not cut through it before you see it. We are going to cut through it, so now you'll take about half an inch or so and come up and cut through the omohyoideus, but be sure and see it first. And then you'll cut through it just cranial to the shoulder, keeping those superficial cervical lymph nodes with the muscles. So cut through omohyoideus here and brachiocephalicus there. And next you'll be cutting through your dorsoscapular ligament so that we can reflect and remove the limb. So I'll cut straight across the dorsoscapular ligament. Now you'll cut your pectorals. So your superficial pectorals should already be cut, but you will need to cut your ascending deep pectoral. So make a cut about 2 centimeters away from the sternum, cut it all the way down the belly, reflect it towards the limb, so keeping the pectorals with the limb, and you'll lift up the limb. So have a partner help you, and you'll be lifting it up like that, cutting along the belly. So here you'll be cutting along those pectorals, lifting up the limb as you do so. You'll also need to cut the subclavius muscle and the cephalic vein. So you want to do that just cranial here, and keep all the pectorals with the limb as much as possible. So as you're cutting, keep lifting the limb up, and then you will have to cut through the veins and arteries entering the limb from the underside. So do that, and then keep lifting up the limb as you go. So again, making sure this pectoral stays with the limb and that I don't cut it off. Lifting up the limb, you'll kind of hear it pulling away. It's easier with a partner, of course. And just keep lifting it up, and then you'll see that serratus ventralis that we talked about here. So you'll want to cut that kind of away from the scapula. So as you lift it up, I'm going to be in the way for just a minute. You're going to cut right along the scapula, pulling that up as you go. You can see it's kind of peeling away. Here you have to cut through the other part of serratus ventralis. So that whole thing is serratus ventralis, and it should stay attached to the body. So here I've removed the limb completely now, and all of this muscle is serratus ventralis. So now you can see the whole thing, but be sure that stays on the body and that you're just cutting a little portion off with the limb.